The Ministry of Health is investigating the death of a 6-day-old baby who died on November 22nd from COVID-19 as a possible incident of nosocomial infection. Head of Internal Medicine at the Georgetown Public Hospital and renowned cardiologist Dr. Mahendra Karpen explained to the newsroom that nosocomial infection means that someone is infected at a healthcare facility, and it could be any disease or infection including COVID-19. Additionally, Chief Medical Officer Dr. Narine Singh told the newsroom on Tuesday that the infant may have contracted the disease at the hospital.
It's safe to say that the baby picked up the COVID-19 infection in the hospital.
Possible, that's very suspect.
Is there an investigation ongoing?
Well, there's several things can happen. I can understand it could be contamination from other things. We did some testing and checking do some swabbing at the NICU room and so on, right? So we didn't pick up anything as yet,
The baby was born on November 17th via cesarean section with a congenital heart defect, and as a result, he was placed in the neonatal intensive care unit and had little contact with his mother. 6 days later, the baby died, and during the post-mortem, he was swabbed for COVID-19 as a precaution, and the results came back positive. The baby's parents were also swabbed, and the results came back negative. According to the chief medical officer, about 12 employees who came into contact with the baby have been identified.
How many staff members?
Well, several of them, I think about 12 of them. But remember, several people was in and out, with the patient. But the guy was back and forth in the maternity unit, back.
Okay, can you say how many staff tested so far?
I don't really think. I think about 6 of them was exactly I think.
And all of them came back negative?
So far, the results that I got negative. Some of them were to do the test later on.
Pardon?
Some of them have to do the test later on because of the shifts and so on.
Meanwhile, the father of the baby, during an interview with the newsroom, claimed that the administration of the hospital told the family that the baby's COVID-19 result was a false positive and handed over the child for burial. However, the chief medical officer clarified that the baby's sample was tested twice and both results came back positive. At the moment, there is no protocol at public health facilities to test maternity patients for COVID-19 prior to admission. Dr. Singh said a COVID-19 test is only administered if the pregnant mother displays symptoms of the virus. There is also no routine testing of healthcare workers unless they come into contact with a positive patient or develop any signs or symptoms. The baby's death is recorded as the youngest person to die from the disease in Guyana, following an 11-year-old girl who was diagnosed with leukemia. Reporting for the newsroom, I am Isanella Patwo.